Oh, okay.
So don't even worry about
Okay.
sometimes I'll just pause and then chop it out.
Okay, perfect.
All right, I just wanted to give you guys a little update on something new that we're just going to institute. There's a thing on the market that's been released recently called a tie-base abutment, or sometimes called a universal abutment. And Noble Biocare has this for their dental implants. And Kelly, if you could just zoom in, this is what the abutment looks like. And what we're going to do is we are going to provide this abutment and the coping for the lab for you with each implant case, unless of course this abutment doesn't work. Now this abutment is a permanent abutment, and it allows you to make a screw-retained restoration with this abutment. And by providing you with the abutment, what that allows you to do is to have the lab fabricate a screw-retained restoration, and essentially you should get no lab bill for the abutment. You should only have the crown. Now you still bill for the abutment and you're still able to collect for the abutment, but you have no laboratory costs for that abutment. So this should immediately increase your profitability significantly on every single implant that you do. Now I do have to put the caveat that it's not for every single implant. It will work for pretty much every posterior implant, and work for a lot of anterior implants. The ones that you do not want to use it for are for those real aesthetic implants where the screw access hole will come out the facial if you did a screw-retained restoration using this abutment. If you have an implant in place in the aesthetic zone and a straight access channel would have it come out through the facial, then what you'll want to do is use an angled channel or what's called an OmniGrip screw that allows you to tuck that back in lingual to the incisal edge so that you don't have a screw access hole on the facial aspect. As well, remember the OmniGrip screw can also be used in the posterior when you want to angle the screw channel forward because of freeway space, because of the opposing arch. So in those two scenarios, you're not going to use a tie-base abutment, but other than that, this thing can be used for almost all other situations. You also need to know that there is a 1.5 millimeter titanium margin down right above the platform head. This allows you to make a screw-retained restoration. You can also do what's called a screw-mentable restoration. So what that means is that the lab fabricates the final restoration and provides the abutment, sends the tie-base abutment, this abutment, to you along with the final implant crown. And you put the abutment in place, you try in the crown, you check the interproximal contacts, you check the opposing occlusion, do any adjustments that you need, and then outside of the patient's mouth, you glue those two together, essentially making it into a screw-retained restoration and allowing you to clean up any potential extra cement off of the margins and not having that cement remain, and as we all know, retained cement over the years can cause problems. I made some notes for myself to make sure I went through everything here, so let me just go through this and make sure that I didn't miss anything. So do make sure that your lab does not charge you for this abutment. It's provided by us to you. There should be no cost for it. This also has the added benefit of ensuring that all implants are restored using authentic Noble Biocare parts. So for whatever implant system you're using, you want to make sure you use authentic parts, and that behind the scenes the lab isn't using off-brand parts or no-name brand parts, because that ultimately leads to failure. So the way this works, patient comes in, everything else is the same. In your bag of parts that you'll get from us will be the analog, the impression coping, and the tie-base universal abutment and the components that are in that package. So the patient comes in, same thing you're doing right now. You're taking a fixture level impression or a digital scan, and then you're sending off the impression coping, the analog or the scan body if you're scanning, and this tie-base abutment, send it off to the lab, and they'll fabricate the final restoration for you. And they either cement it in the lab for you, making it a one-piece screw-retained restoration, or you're going to do a chairside. The one thing you need to know, the potential point of failure with this is the connection between the cement and the abutment. That can come loose over time, although using today's resin cements that you guys are way more familiar with than I am, that's rare. If it does come loose, if the cement does fail, you just re-cement it back on. So although a nuisance, not necessarily a catastrophe. So this is something new that you're going to see, these tie-based abutments, and providing those materials for you, significantly increasing the profitability for implants for you. If you have any questions, give us a call at 509-922-2273. Thanks, guys.